Merck is acquiring an approved medicine for COPD, the respiratory disease that includes emphysema and other kind of related conditions. And they're paying $10 billion for this medicine that they believe can reach mid-single-digit, multi-billion-dollar revenues in the coming decade. And in terms of how this fits within Merck's strategy, they're a massive global pharmaceutical company, and they make the world's best-selling drug in the form of Keytruda, which treats a bunch of cancers.
So Keytruda is a best-selling drug, like, anywhere?
In the history of pharma. Now, some of that is inflation-related, you know,
That's
like
cool.
the dollars that it puts up. If we adjusted for inflation, perhaps, you know, some antibiotics from the past might contend with it. But
pretty good.
With the numbers we have, it's the biggest drug in the history of the world. But like all drugs, it has a finite patent life. And in the case of Keytruda, it will lose patent protection in the United States and around the world later this decade. So that's a $30 billion, roughly, annual product, that cancer drug. And it's about 50% of Merck's revenue. So you can imagine they got to replace it. So this deal, in adding this one drug that Verona Pharmaceuticals got approved last year, is by no means going to replace Keytruda in one bet. And Merck wouldn't aspire to do that. I think they're taking kind of like a Moneyball approach here, that Keytruda will one day erode and eventually go away. And they can't replace it in one fell swoop, but they can perhaps do so in the aggregate by acquiring products like this.
So, Damien, how does this compare? Just kind of contextualize this for us. How does this compare to some of Merck's previous deals?
They have been biased toward things on the small side, I would say. They say constantly we're in the $1 to $15 billion range, and they look at it as bolt-ons. So what Merck would say is we look first for good science out in the world, a promising approach to a disease that needs new therapies. If we like it, if it jives with what we're good at, we'll go out and pay for it. But they have not historically been interested in like mega mergers, something over $10 to $15 billion, as some of their competitors have done. And I think what Merck and many analysts would say is that when you go back and look at those mega deals in the drug space, they're often not accretive in the long term. There's a lot of waste. There's a lot of red tape that gets tied up. And so I think Merck's approach is very much, we know what we're doing. We can spot what's good out there in the world, and we'll bring it in when it works for us.
When a drug goes off patent, particularly as one as successful as Keytruda, how does that erosion process work? Is it 50% in the first year, then it evens out, or is it just kind of a couple of percent every year, just kind of losing share?
It varies, and this gets a little bit into the weeds, but the famous patent cliffs we might remember of like Lipitor, for example, where it was like 80% the next day. Those are pills.
Is that right?
It was maybe not the next day.
No, but I get you. But
it was a massive drop. That's because those are pills and they're relatively easy to make. Right. Keytruda is a complex injectable medicine called a biologic, and technically there's no such thing as a generic. There are biosimilars. We don't need to get into the weeds there, but basically what we've seen for drugs like Humira, which was previously the best-selling product in the world, which is also a biologic, that the erosion curve is much less steep than it is with pills, for example. So the expectation is that by about 5 years from Keytruda losing its patent expiration, the net price would come down about 50%. And that's very dramatically different from, as we said, with the pills where it's like almost instantaneously decimated.
Damien, does this signal a comeback in deal making for the pharma sector?
That's what everybody has been kind of looking for in 2025 and even late last year, because the valuations of biotech companies have been so beaten down in recent years that you would think, or it would follow logic, that the Mercks of the world would be like, oh, wow, there's bargains out there to be had. But what we're learning time and again is two things. One, just because a biotech company's valuation is down doesn't mean its CEO and its board think that that valuation is correct. So if you come in with an offer that's based on my current valuation, I might say, well, I think I'm worth twice that. And if we just wait, then the market will prove me correct. And that stands in the way of deals. And then also pharma companies don't necessarily think that way about like bargain shopping. They think about like, we need a new cancer drug. We need a new drug for a lung condition. So whether this signals a turnaround, I would be loath to make that prediction because it is so idiosyncratic out there.